I have a 45-degree sponge, a gown, some chucks, 500 milliliters of barium, some lubricant, and then I have this bag for the barium and this to put in the patient, and I'm going to go get my patient now. Kelsey? Hi, I'm Joey. I will be helping with your exam today.
Okay.
Can I get your last name?
Hammerkirk.
And your date of birth?
January 29th, 1994.
Okay. So, do you know what we're doing today? Like,
A barium enema.
okay. Have you gotten that done before? All right. I'm just going to explain it to you. We're going to have you lay on the table, and then I will be putting this into your rectum, and we're going to be injecting some contrast into your colon. The radiologist will come in, and he's going to have you roll around a couple of times, and we're just going to be looking at that, and then I might take some images afterwards. It might be a little uncomfortable, especially if it gets going too fast, so just let me know if you start cramping, and we can slow it down a little bit, okay? All right. So before we get started, is there any possibility of pregnancy?
No.
Okay. Then do you know if you're allergic to the contrast?
No. Not that I know.
Alrighty. So when was the last time that you ate?
It was before midnight.
Before midnight? Okay. And we gave you a cleansing enema and a clear liquid diet. Did you do both of those things?
Following it.
Alright, perfect. Alrighty, I'm going to have you take everything off from the waist down and put on this gown.
Okay.
The open side goes through the back.
Okay. Alright.
Alright, and have you had any surgeries?
No.
No? Alrighty. We're ready? You can go ahead and lay on the table. I'm going to take, I'm going to go ahead and put this in, and then we can go get the radiologist. Actually, first, we're going to take one image. Sorry.
That's okay.
My 14 by 17 cassette is tracking with the tube. I'm just going to feel on your hip here. Right. No, I can use it. Okay. Alright, Kelsey, go ahead and take a deep breath in. Blow it all the way out. Stop breathing. Exposure. You can breathe. Okay, technique for this one is 80 at 12. And, yep. Alright, now you can go ahead and lay on your left side for me. And then kind of just bring your right leg over like this. Okay, then I would have put some lubricant on this and put my barium in here and shaken it up for 30 seconds. And then I would have ran the line to make sure that there's no air in it. And then I would put this in going anteriorly and then superiorly. Kelsey, go ahead and take a deep breath in. Blow it all the way out. Now we put it in. Alright. I'm going to go get the radiologist now, and then we can start on the exam. After the radiologist is done, I'm going to do the overheads that he ordered. Oh, and then it's 40 SID. Sorry. Alright, go ahead and roll back on. Actually, roll on your stomach for me. We're going to do it that way.
Okay.
No, you're good. Alright. Go ahead and stop breathing. Exposure, you can breathe. This one is 80 at 16. And this shows the contrast in the transverse colon because it's PA. Now I'm going to do my axial. This is a 30 to 40 degree angle. And it's centered at the as is. Right. All right. Great. All right, just like that. All right. Okay, go ahead and stop breathing. Exposure, you can breathe. This one is also 16 at 80, and this shows the rectosigmoid. Alright, Kelsey, I'm going to have you turn a little bit to your right side. I'm doing my RPO, or RAO now. The 45 degree sponge. It's 35 to 45 degrees. Okay? Yeah, you can bend your knee a little bit. That would be more comfortable for you. All of these are centered at the iliac crest except for, so far the one I did that wasn't was the axial. Okay, and then this is centered an inch to 2 inches laterally from the spine towards the elevated side. But we are looking at the side down. Okay. All right, this one is 80 at 18. And Kelsey, go ahead and stop breathing. Exposure, you can breathe. This one looks at the right hallux flexure. All right. Okay, I can take this now, and I'm going to have you just go ahead and roll all the way up onto your right side for me. Yes, you can take it off. Oh, good, good. Okay. So now I'm going to do my right to cube. Probably. Okay, you might want to close your eyes because there's going to be a light. Don't know where it's going. Then I'm going to get my IR. probably gonna get this. I don't know. Alright, Kelsey. I'm just gonna have you hold this. I'm gonna put this behind you here and just kind of reach over and hold it just like that for me. Okay. Okay, this is centered at the big crest. Okay, just gonna bring this over. Alright, you got it?
Mm-hmm.
Alright, just like that. Check rotation. It's good. Alright, go ahead and stop breathing. Exposure, you can breathe. This one is 16 at 80. And this shows, I can take that. This shows the, let's think. Lateral side of the ascending and medial side of the descending colon filled with contrast. Probably. Alrighty, now we just have, I'm going to have you go ahead and roll onto your back. Sorry about the legs. Alright, we just have 2 more left. You okay?
I'm great.
Better than you. Better than me. Alright. Okay. Alright, I'm going to do LPO on you. There we go. You can keep that leg bent up if it's more comfortable. Alright, this one is 1 inch to 2 inches from the mid-sagittal plane. And we are looking at the side up for this one. And we are centered at the iliac crest. Alright. Just like that. Go ahead and stop breathing. Exposure, you can breathe. This one is 80 at 18. Alright. Okay, Kelsey, now I'm going to have you roll up onto your left side for me. And you can bend your knees. That'll probably be a little bit more comfortable for you. I'm going to have you bring your shoulders back just a little bit for me. Just kind of bring the left one towards me.
This one?
Yep, just like that. And then bring this one back too. We're going to try this. There we go. Okay, just roll this hip forward a little. Okay, this one is centered at the as is. You can calmly down a little. marking the side down. Got some light on that. I'm gonna call me out. That looks good. All right, go ahead and stop breathing. Exposure, you can breathe. This one is 80 at 20. And you see the rectum and sigmoid in the lateral. All right, Kelsey, you can go ahead and roll back onto your stomach. So, actually, I should have had you stay in that position you were in. You can roll back onto your side. So, I would go and show the images to the radiologist, make sure we have everything we need, and then I would go ahead and take the tip out. I would drop the bag to the ground and let all the barium flow out as much as possible. And then I would pull the tip out, and I would just have Kelsey go ahead and take a deep breath in, blow it all the way out, and then I would pull it out, and then that would be done. All right, then I would let Kelsey go and use the bathroom, and try to get as much barium out as you can, and then we are ready for our last image, which is the posty back. You can go ahead and lay on your back. I'm just having you move around a lot. All right. You did such a good job of just laying right where I want you. It's like so perfect. Okay. All right. Go ahead and stop breathing. Exposure, you can breathe. This one is 80 at 16. Pretty sure. No, 80 at 12. Okay. It looks like we have everything we need. I'm going to just get this out of your way. Make sure the table's all the way down. Okay, you can go ahead and sit up. So, I'm going to let you go ahead and change back into your things. The barium can cause constipation, so just be drinking a lot of water. You're probably hungry, so go ahead and get something to eat. And if like you notice like any white in your stool, don't be alarmed. That's just the barium. And if you do develop constipation, then like call your doctor and talk to him, and they should have the report read really quickly and be able to get that back to you. But if they don't get that to you in the next couple days, you can call them.
Okay.
All right. Is there any questions before I let you go?
Nope.
All right. I can take you out, and well, you can go ahead and change into your things, and then I'll take you out.
Okay. All right.
Thank you.